Peace, y'all. It's your girl Nicole, Sister Midwife, bringing you my first video to talk a little bit about some of the thoughts that have been going through my mind with this COVID-19 coronavirus thing. I've been saying I needed to come, share some content, share some information, thoughts about it, and life just has not allowed, So last weekend was the first weekend of my March New Orleans birth sister doula training, and so leading into that training, I had to make an assessment about whether I would have the training or not, specifically knowing and understanding that the sister midwife training lasts for 2 weekends. So that means now we're facing another question about another training weekend that would start on Friday if we were to move forward with the full training. So lots of things have been happening in my world in terms of reproductive justice and supporting families and individuals and community members around birth work and just in life. And so things have really been really tight. And then the coronavirus situation came up and I had to sit back, make some assessments, make some decisions. And the thing that was so interesting to me was that the 10 women who showed up last weekend to be in community, to have the first weekend of information and training of the sister midwife birth sister doula training, they showed up. They showed up for birth. They showed up for women. They showed up for families. We knew that we were all looking at the very beginnings of what at that time was just about to be called a pandemic. And we knew that there were a lot of unknowns, but they made a decision, we made a decision collectively to show up for families, because one of the things that we know for sure is that before this thing, during this thing, and after this thing, people will become pregnant and women will be having babies. And as birth workers, we have to be able to show up for them and we have to be able to support them. There were a lot of different conversations, a lot of drama involving who could be at a birth. In some facilities here in New Orleans, they were saying that the doula could not show up. I know that there are 2 particular hospitals who have made statements saying that the doula will be considered a part of the birth team and that they can show up without complication or without issue. But I know that across the country, these conversations continue to happen. Is the doula a family member? Is the doula a friend? Or is the doula actually a member of the health team? And we know that we improve outcomes, we impact birth. We know that doulas make birth different and oftentimes better for the families who are working with them, and that they should indeed be included as a part of the healthcare team and not ruled out as the single one visitor. They should not be counted as an additional random visitor. So one of the things that I am excited about is that 2 of the main hospitals here who do birth in New Orleans, they have issued statements that doulas are allowed, but they've also put a caveat out there that said certified doulas, some of them with certification, they've said that certified doulas with documentation. And so what I want you to know is that if you train with Sister Midwife Productions and you need some documentation to allow you to get into the hospital to support women, please email me, smpdoula@gmail.com. No matter where you are across the country, if you are having difficulty with a facility about your right or the mom's right to have you as her support person, and you need any type of documentation showing that you are certified and qualified to support women in birth, please email us, smpdoula@gmail.com. You have my personal cell phone number. Do not be afraid to reach out. Do not be afraid to contact us to let us know what you need. We want to support you. We want to make sure that you are able to stand up and support the families who are in need in this critical time. I also want to mention and shout out to Sumi's Touch out in California for really making me aware of a time like this, how impactful and how important the Black Midwives and Doulas Directory can be. So she made a post that was so eloquent and so beautiful, talking about the history of the fact that we have always supported our own. We have always had home birth. Home birth was, then, is now, and will always be an option for so many individuals out there. If you are in a crises and you feel like you do not want to birth your baby in the hospital, I know that across the country there are midwives who are making concessions and accepting clients who are low risk, who are home birth candidates, who do not want to move into the hospital. If you're looking for some information for additional contacts in your community, please visit our website, sistermidwife.com, and you can search our directory, SISTA midwife.com, and you can search our directory. It is full of midwives and doulas from across the country many of whom would be able to help you and interested in helping you during this time. So I'm going to end it now. I do still have a lot happening, making decisions about how we're going to handle this second weekend of training. I know that we're definitely going to move to virtual for the first Friday, and we'll figure things out. But, you know, like I said, we're going to have babies. Before, during, and after this, we will be having babies. And so we are here to support families, to support the movement. We know that birth is the revolution, and maybe this is the type of revolution that we're looking for and in need of. Peace.